I work across multiple healthcare settings. I know what it's like to be a hospital in a county with a smaller competing clinic, and I know the other side of the coin as well, to be the small clinic with a competitor running the hospital in a county. Either way you slice this, eliminating a non-compete for APPs and physicians puts an operational burden on the rural hospital. Our rural healthcare facilities cannot afford the costs of a continual provider recruitment. It's a multi-year process, and we look for a relationship and a good fit. A rural hospital is a wonderful space to hone your clinical skills. In Chamberlain, for example, you're working in an ER, you have a family practice clinic, you're conducting long-term care rounds, you're delivering babies, and you're also managing hospital inpatient and swing bed rounding. It's hours of call, it's weekends, it's holidays. And the smaller clinic just down the street that isn't open 24/7 and doesn't have near the hospital responsibility like you do might start to look pretty good. Without a non-compete, the couple of years of orientation that we provide is lost. Our provider team spends hours with this individual working to help their colleague and support them with getting comfortable in hospital practice and honing their clinical skills. Those costs and the cost of recruiting them are all gone. The non-compete we use, it was referenced earlier, restricts employment with a competitor for 20 miles and 2 years. It helps us plan operationally if a provider leaves. It also is a reminder that the work that goes into provider development is not free. Opposing this bill shows you stand with the rural hospitals in provider recruitment and retention. It shows you understand the challenges of rural hospital and emergency care.
Physicians are required to abdicate their ethical responsibility to a patient. Not only is there an ethical premise at play here, South Dakota has statute that requires us to see patients and not abandon them. An employer can cause a physician to violate both South Dakota codified law and their ethical duty to a patient instantaneously by terminating their employment. They have unilateral authority to do that with no warning for a patient prior to that termination of employment. So imagine that you or a member of your family were on their way to their chemotherapy appointment for a very complex regimen with their oncologist, and you get there only to find out that your physician's been terminated. You got to start all over from scratch again. That physician has no ability to take care of you in the community in which you reside. They have no ability to take care of you within a geographic area, in some cases 20 miles of where you practiced, in some cases within 50 miles of any place that the enterprise has a foothold. And that's going to go on for 2 years. That's incredibly demoralizing to a patient and a family to have to experience that. I've been on all sides of this debate, restrictive covenants, covenants not to compete. I've signed one. I've refused to sign one. I've negotiated for them with providers that I've hired. And I've had people come to seek my counsel when they were trying to figure out a way to stay in the community where they work and to keep taking care of patients when it didn't seem they had any avenue to do so. And I've evolved my position on this. I used to believe that they were an important part of protecting my business, much as we heard from Ms. Reese. Now I believe that they are antiquated, draconian, and protectionist at best. They are a detriment to health care, and I believe that not only to exist in South Dakota, but nationally. You know, I've heard that the hospitals here today advocate heavily for non-competes and why that was so vital and important to their health care business. But I have to tell you, I have also seen them personally interfere in restrictive covenants when it's to their benefit. So the hypocrisy of saying how important and vital it is to me when it's convenient, but it's not such a good idea when it works out to their benefit is somewhat troublesome for me. I don't think they're good for anybody in health care. I think the patient's interests trump, and I think that it's time for South Dakota to take a lead and make sure that patients have access to the care that they need and that they can really find that their provider is there for them when they need them, when the timing is most critical.